Machine learning is currently revolutionizing the field of healthcare. It is a valuable tool that healthcare providers can take advantage of. This is because machine learning algorithms work by analyzing data, in this case, a patient's symptoms, and try to find patterns in it. These patterns can help healthcare providers more easily make diagnoses. For example, if blood test data from a sick patient is fed into a machine learning model that was trained on a wide variety of blood test data, the model can suggest that since the results of the test were similar to another patient who was diagnosed with a certain disorder, the other patient might have that same disorder. While machine learning models are very useful, it must be acknowledged that there can sometimes be errors in outputs of the model. That is why it is often used as a tool to assist healthcare providers diagnose patients rather than being the tool to directly diagnose patients.
There have been many successful machine learning models made in recent years. The problem with many of these models is that healthcare providers often do not have access to their results without a CS background. This is in part because the deployment of even successful models has often taken a backseat to continued development. This reduces the number of people that could potentially be helped by this model. In addition to this, it is also sometimes difficult for healthcare professionals to interpret the results of the models without a CS background. Another problem that many healthcare providers face is the fact that many models require data to be processed into different formats before it can be processed by the machine learning model. This is also difficult for someone without a CS background to do.
The solution to the problems listed above is deployment of models in such a way that it is accessible for somebody without a computer science or technical background to use. In this project, first a successful open source model will be selected. Then a data processing pipeline will be built so that FHIR data can be converted into a format that is suitable for the model to use. This is because FHIR is a widely accepted standard for healthcare data, and it would be easier to integrate the usage of the model into existing workflows if there was a data processing step built in. Afterwards, the model output data will also be converted into an FHIR compliant format and displayed in a way that is familiar to healthcare providers. In addition to this, the model will be hopefully hosted online to maximize access. Users will be able to easily drag and drop their data file onto a page in the site for a model to use so they don't have to deal with the complications of running the model locally. To test this site, data will be generated using Cynthia, an open source tool that generates synthetic patient data that follows FHIR standards.
So here's the demo of our project. You can go to healthinfo.vercel.app to actually try it out for yourself. So the UI is simple and minimalistic, ensuring that professionals who haven't used our project before could understand it and start using it immediately. First, you can generate a random patient. Of course, in real world settings, a professional would already have patient data and could just upload it and skip to the next step. So I can hit generate. And behind the scenes, we use Cynthia to generate realistic FHIR patient data. Cynthia is an open source health data engine which uses publicly available data to generate synthetic health records, which can be again exported to FHIR. One slight note is on some devices, if you do try it out, the font might be in white, so you might just highlight over, you can just see it, but yeah. Next, we take this data and we can use it to predict actual heart disease. The data is first transferred from this FHIR format into a format that's more like applicable for the machine learning model, and then it's fed into the ML model. We This results in two things. First, let me run it. First, we can see, is there a high likelihood of heart disease? Yes or no? And then we can see the actual FHIR risk assessment data right down here. Healthcare professionals could add this FHIR data with existing patient FHIR data. Now, regarding the entire project, the front end uses Next.js and JavaScript, and the back end uses Flask. As mentioned, the backend uses Flask, and the initial plan document had us deploying the full project to Vercel. But while this was good in theory, Vercel has a size limit for how big the Python file could be, as they're hosting it for free. Because our model and the Flask backend is quite big, Vercel couldn't handle the entire backend due to size constraints. So instead, I had Vercel just handle the front end logic, and I used Google Cloud Run, so I used the Cloud Run to actually host the backend. Regarding the implementation plan, we first generated synthetic data using Cynthia in FHIR format. Then we researched and finalized machine learning models to use, and that's how we came to the heart disease model. Then we understood the inputs for how to take FHIR data, how to convert it into something the model could actually use.
Then I created a data processing pipeline in order to convert the FHIR user data into a format that was usable by the ML model. I also created a data processing pipeline to convert model outputs into outputs, aka the risk assessment, and I created Flask backend endpoints that and had the model file saved to run.
Then I created the entire front end in Next.js, designed the UI UX components, and I had the website hosted in Vercel, and then the backend hosted in GCP. And then we both did testing and miscellaneous bug fixes.